For most people during their working years, health care is an employer provided benefit. So that means the employer's choice affects what's available to you and how much things cost. But once you stop working, you're in charge of a lot of those choices, at least to some degree. So we're going to talk about what you might expect in retirement for healthcare costs. We'll start out with some of the options and the costs you might expect before age 65. And then once you reach 65, for most people, that's time to start Medicare. You might also face long-term care expenses, and that's not just after age 65. It can happen at any age, but as we age, those types of events tend to become more likely. So we'll talk about the potential costs and averages and studies related to all these different things, and then get into some tips that can help you as you plan your retirement income. You've probably seen some big scary numbers when it comes to what healthcare will cost in retirement, and Fidelity, among others, does a study every year that talks about how much it might cost. Now, some people underestimate these costs. I'm not sure that people get it this wrong as they're showing in the chart, but people might not understand exactly how much you pay. And then when you look at the big number, it can get pretty scary, but we're going to make that a little bit less scary and put it into context and paint a picture of how things might actually unfold during your retirement years. Before age 65, you're typically on your own when it comes to getting health coverage. Now, some people get paid retiree health care after they stop working. That's a pretty nice benefit, but not everybody gets it. So what do the rest of you have available as far as coverage? One option is COBRA, or state continuation, depending on how big your employer is, and that's where you can continue on your existing workplace plan, basically, for 18 months after you stop working. A couple of things to know about that is, number one, that you will be paying the full price. So if your employer was paying a portion of those premiums, you are going to have to pay the full premium plus a little bit extra, and that might be surprisingly expensive. So you want to do a lot of research so you figure out what that's really going to look like if you decide to go that route. The other thing to know is that if you're getting close to age 65, you want to be very careful about using this type of continuation because it might not qualify as coverage for Medicare, and that can cause problems. So if you're anywhere near age 65, basically for anything, start talking with your employer or your healthcare coverage provider and find out what you need to do to avoid problems with Medicare. Now, that coverage only lasts for 18 months, so what if you need it for a longer period? So if you're married but your spouse will continue working and they have coverage through their employer, you can potentially get on your spouse's plan. Now, there may be some change in cost, but you can get coverage, and some of it might be subsidized by the employer, so that could potentially be a good option. There's also the option of buying your own coverage, so you might buy that from an insurance company, potentially on the marketplace or the exchange, depending what state you're in, and that allows you to just buy your own policy and make some choices about levels of deductibles and out-of-pocket maxes and premium amounts. These are the types of programs that can potentially get you a discount if your income is below certain levels. So we'll look at that in more detail in a second. But the thing to know is if you don't qualify for any of those tax credits or subsidies, it can get quite expensive, and we'll look at some numbers in a second. And then some people look at sharing arrangements, and that might be something that is not technically insurance, but it's a way to share some costs with other people and get some health care paid for. What I would say about those, I'm not going to get into detail here, but be very careful and do a lot of research before you go down that road. A number of different things you might want to be aware of. One is just that it's technically not insurance, and you don't necessarily have all of the consumer protections that you might have grown accustomed to or that you might expect. So if you're going to buy your own coverage on the marketplace or exchange from an insurance company, you might want to do a lot of research sooner than later to take a look at what it's going to cost you. You can start the process pretty easily by going to healthcare.gov and looking up insurance plans available in your area. Now, you want to be prepared for some annual cost increases because as you get older, the prices tend to rise, and plus inflation kicks in and insurance premiums just tend to go up. It's also important to consider what rate of inflation you might assume as you go into retirement. So you might expect that prices are going to rise over time, but your healthcare costs might rise at a different rate and it's probably wise to assume that those costs would rise at a faster rate than general inflation. So be sure to think about that as you do your planning. So here are some national averages for a silver plan that somebody might buy themselves. And as you can see, the prices tend to rise over time, and that continues throughout life, by the way. You're typically going to pay a little bit more for health care each year, but at age 50, they've got $612 a month is the monthly premium plus some out-of-pocket costs. I will say that that looks maybe a little low to me depending on where you are, but we're talking national averages. So if you're in a big city with lots of providers, the cost might be lower. If you are outside of those areas, you might expect to pay more than that. But you could potentially pay less than this. So here's an example. This is something that a client put together. And by the way, most people aren't quite this organized, and they don't do all this, and it's not necessarily relevant for everybody depending on your circumstances. But here's somebody who was going to pay $825 per month at full price, but they could potentially get some of the subsidies or tax credits. So if they were able to keep their income low enough, they would get a pretty healthy subsidy. For example, if they could be at $40,000 per year, they would get a subsidy of $655 per month. So instead of $825 a month, they would be paying only $170 per month. So that's a pretty healthy discount there. That can really save you a lot of money per year. Now, it's not always the right move to try to lower your income just to get those subsidies. You do want to look at the bigger picture out there. What are the other things that are going to happen with your income and your taxes, both today and in the future? So don't necessarily assume that this is always the best thing to do, but it can often be quite helpful to save a little bit of money on those premiums. By the way, you can build your own chart like that if you want, using some tools available maybe from your state, or there are some other calculators out there that can potentially help you figure out what things might look like at different income levels, and then you can decide what makes the most sense for you. For most people at age 65, it's time for Medicare, and that usually means you're going to have lower costs, especially if you've been paying full price for your own coverage. However, your income is a factor, so if you earn a lot or you show a high income, possibly just from taking withdrawals from a pre-tax IRA or from other sources, you might have investment income or something else going on, you could potentially have to pay more each month. So you want to watch your income even in retirement once you're on Medicare. This is still important. And Medicare can come in a variety of different flavors. You don't just get Medicare, but you have some options in terms of additional types of coverage you can use, whether that's a Medigap supplemental plan or Medicare Advantage. You might want to add a drug plan. Those are all things that are beyond the scope of this video, but the most important thing to know for your retirement planning is that you may have some costs during Medicare. It's not free. And you also want to do some projections to figure out what it might cost for you based on your health. So what I would suggest is speaking with a healthcare broker who can help you figure out the options available and have some really detailed conversations. So if you just say, I want the lowest monthly premium each month, they can do that for you, but it might not be right for you. It might not be the best thing for you, because if you travel or if you have certain conditions, you might be better off with a different program. So have some detailed conversations about your needs. Talk to your doctors and your healthcare providers and ask them, hey, do you take Medicare Advantage? Or what would you suggest if I want to keep seeing you? And they can give you some pointers as well. By the way, I'm Justin Pritchard, and I help people plan for retirement and invest for the future. So in the description, you're going to find some resources that can help you with retirement planning, and that'll touch on some of these healthcare related topics in particular. This is also time for a friendly reminder that it's just a short video and it can't possibly cover everything. So please do a lot more research. Hit pause and read this, and we'll move on with the rest of the video. But talk with professionals and get a lot more information before you decide to do anything. So how much do you spend on healthcare, in particular in retirement? And Fidelity does a study each year, and they update the numbers, and this year it was up 5%, but depending on when you watch this, the number might keep increasing, and it's about $315,000 for a couple, Or for singles, we're talking 150,000 for men, 165K for women. So this is throughout retirement, starting at age 65 and ignoring long-term care. That number can seem staggering, and those are some pretty big numbers, but if you think about it, you're not necessarily spending all of that at once, and you typically have income coming in each year to help you pay for those costs. So you might have some Social Security income, you might have a pension, you might take withdrawals from your retirement savings, and all of that together can help you pay for retirement. You don't necessarily write a check for $300,000 right at the beginning of retirement. So another way to look at this is sort of that annual cost approach, and this is Fidelity's calculator. Again, we'll have a link in the description below, but let's say we have a woman age 65 today, and she's going to retire today, and we'll say she's going to live to about 93. That seems reasonable. She might be spending $5,800 in her first year of retirement here, and over time they show her at $195,000. So it isn't like you're, again, paying that whole cost up front and you need a lump sum available. You can pay for it as you go. And another way to look at it is this Vanguard Mercer study, where they look at a 65-year-old woman, and they go by risk factors here. So maybe you have one or two chronic conditions or smoke or something like that. The more of those you have, you'd fall into this high risk profile here versus a medium risk. So let's just look at the high risk. Per year, total out-of-pocket costs, so that includes, some premiums, plus those out-of-pockets. Dental and vision, by the way, are not covered by traditional Medicare. What might you expect to spend? And it's in that $6,000 ballpark for the typical person with, not too much going on health-wise. Again, you would expect those costs to rise over time as you get older and potentially develop more health issues. Next comes long-term care, because those previous estimates excluded long-term care. And so this might be if you need help doing things, or you're in a nursing home, something like that. This is the big unknown when it comes to retirement planning. We just don't know if it's going to happen, or how long it's going to happen, or what the severity might be. I mean, on one end of the spectrum, you need somebody to just come in for a couple hours and clean up around the house. On the other end of the spectrum, you could be in memory care and you need 24-hour supervision, bed alarms in a camera room or something like that, so that you don't wander and hurt yourself. We can't really say for certain what kind of care you will need, but we can look at some probabilities and maybe make some guesses. So the odds that you might need any type of care are reasonably high, and then it depends on the type of care, and as you might imagine, the costs are much different. So unpaid care, obviously, from family and friends doesn't necessarily have a direct cost to you, although there are some costs to everybody, including your family and friends, by the way. Then you've got paid home care. Again, somebody could come in and clean up, maybe cook meals and do other things. And then we can continue on the spectrum from there. As you make some assumptions about what retirement might look like in your care, you can look at, how long it might last. The good news is that typically less than half of the time does it go on for 5+ years, but there's still a decent chance that it could go on for 5+ years. And again, there are some different ways to pay for this. You've got family members, friends, or you're paying out of your own assets, for example. You might use insurance products, a variety of different options there. You might plan for eventual long-term care, starting along a continuum of different communities that you live in that might let you move on to higher levels. You might use your home equity. That could be a nice safety net for people if they do end up needing care. You typically have a lot of assets in the home, and you might not necessarily expect to use those, and maybe the kids don't want the house. So if there are kids, so that can be a resource for you to use. Now, if you end up not having enough resources to pay for the care you need, then Medicaid is the eventual safety net. So that means spending down your assets, and you typically don't have a lot of resources to live on and have fun with, but you would be able to get a lot of care, and that can be very expensive. So that's where Medicaid becomes very handy as a safety net. So how can you improve the chances of affording health care and staying comfortable during retirement and not having to make sacrifices. Well, planning ahead is always helpful. It just helps to run some numbers and do some what ifs, and might make sense to use some tax strategies, for example, that can help you either qualify for subsidies or to help you avoid extra costs when it comes to Medicare. So if you can manage your income and keep it low enough, that could help. That might be Roth conversions or just saving with Roth or withdrawing from pre-tax accounts during years when you have low income. There are a lot of different ways to look at this. If you are eligible to save in a health savings account or an HSA, that's probably a good idea. Now, the thing that a lot of people don't know is that you don't need to spend that money every year. It's not use it or lose it. So you can put the money into an HSA if you're eligible and then leave it in there to grow over the long term. That might be several years or decades. And that way you have a nice pot of resources to draw from when you eventually have higher healthcare costs. Staying healthy is also important. So, to the extent you have control over your health and those costs, then that's really a good thing to do. Now, luck and genetics and different events can all come into play here that you don't have any control over. But if you can stay active both mentally and physically, that can help you keep your mental and physical health in decent shape. And because of that, that may improve the chances of keeping your healthcare costs as low as they can be for your body or for your luck or your circumstances. So, always good to do that as well to whatever extent you can. So, I hope you found this helpful. If you did, please leave a quick thumbs up. Thanks and take care.